And just like that, we are back. We are back. This is exciting. What a great day. So I have two classes this semester, and one is Gjertsson Technology, which is technology related to older adults. Like gerontology is the study, the science behind aging. So Gjertsson Technology is taking that technology about aging patients and using certain technologies for different parts of aging. So back in the Obama day, he put together an initiative where all health records are now electronic or should be electronic. So when you go to the hospital, they could send your electronic records to the doctor, and the doctor, or if you switch doctors, they could electronically send medical records. And it's supposed to improve care for people, and I imagine in some cases it does. I know at the VA, they implemented this type of system back in the 70s, but the VA, which I love, is, all of your doctors are right there. So you're not going to a doctor out of state, you're not going to a doctor somewhere else, and all of your records are within the VA. If you move to a different state, you don't have to get a brand new doctor, you're going to get the VA group of doctors, and they still have all of your medical records. So the idea and thought is, of tracking different things is good. And when you look at that, I had to do a whole paper on writing what all of this means. But some of the things that come away from this is that they take data now. So now, once all your medical records are in there, now all the data, and I'm not sure this side of it yet, but all that data comes together and you're unidentifiable, but your data is there. And they take that data and then they predict certain things about what could possibly happen. So one study in one hospital where they took predictive and predicted data, they were able to identify patients in that hospital that were likely to get sepsis with 85% accuracy about 30 hours before the outbreak. So think about how that type of technology could actually help a patient. So normally if a patient gets sepsis, and some of you might have even gotten this in the hospital, normally when a patient gets something like that, the doctor is alerted with tests about 2 hours prior. So by putting in all kinds of parameters about people and different stats about people, they could go, okay, I'm going to take this whole group and name 10 things that these people are most likely to get sepsis. And then they could look at their patient that they have and say, hey, does the patient have these 10 things? And if the patient does, chances are good that patient is going to get sepsis. So they could predict that out 30 hours, which gives them a lot more lead time to start treatment. So the treatment speeds up by the amount of data that people are putting into the hospitals. So they also use collection of all of this data to determine things like who is most likely to be readmitted to the hospital, which is fascinating because now what they're doing is they're looking at patients in the hospital, and they're taking all their stats and compiling them, and then they run them through these AI algorithms that pull out people, and they're like, you are most likely to come back here in the hospital. And because they believe that, whoever, Johnny, is going to get readmitted to the hospital, they'll use as much care as possible and things that they know to make sure that he is well before he leaves so that he's not readmitted. Some of the other things that they do to predict health outcomes is they use this to determine how long somebody is actually going to stay in a hospital bed. So many of you know what that's like. You go to the hospital and you're out in a hallway waiting for a bed. So they could use this predictive analysis to see how the hospital bed turnover is. And why is that important for hospitals? Because then they could staff appropriately, they could identify healthcare fraud appropriately, they could improve their overall health for the patient if they know how long you're going to stay. And they know how long you're going to stay based on a boatload of demographics. Boatload is like my technical science term that I use. So, yeah, just a bunch. So they take a boatload of statistics and then they run them through, and then they say, okay, Johnny falls into the category of these 52 things. He is most likely going to need an extended hospital stay. Well, if he needs an extended hospital stay, then that might not free up the room the way it's supposed to. So using this type of technology where they collect all of this data is really helpful in how hospitals and offices are being run, especially with patient care. So I was reading a study this morning how they were using this type of technology to even see if people in different demographics had the markers for an Alzheimer's, which, when you think about it, is you put all of these types of characteristics, there's so many risk factors and so many characteristics of each and every disease and so many medications. So the other study I was reading this morning was on polypharmacy, how people take multiple medications. Well, when you're taking multiple medications, they have an effect on your body in different ways. I don't know about you, but if you watch any commercial on TV that is touting any medication, the list is endless. And then they always throw in, and you could die. Well, I don't know many people that are calling up their doctors going, hey, I saw, during the Super Bowl that I should take XYZ, and they told me it's good for my throat, and I could die. What are those commercials about? But that question is so important, and everybody should be asking it.
And even up to including that.
Right.
Mom got a prescription this week. She says I could die.
You're kidding.
No.
And then it's like, and take 4. What the heck?
Take 2 a day for 5 days, and then we'll cut it back to 1 a day. Give us something to eat detrimental to your health. It's going to raise your blood pressure also.
Right.
You look at these
Yeah.
prescriptions and you're like, who in the world thought this?
Right. And I don't know. And the interesting part is when they put them on television in a commercial, I feel really weird about that. Why are we pushing these medications on people that clearly have long lists? Why is that even approved? At the end of the day, why is that even approved? Why? I do. I really want to know is how does something that's so detrimental to my body get approved to be good for one thing in my body? So that's the issue too with polypharmacy and taking a lot of different medications is that, something good is happening in one area and something not so good could possibly be happening in another area. And then you're limited to what else you could take and what else you could do. So that's why in Gjertsson technology, when they take all of the data and all of the statistics and compile them and run these algorithms, they're able to now see what kind of medication you're taking and how they all interchange and interact, and if that's even effective or if you're going to, die from whatever that is. So the technology really is evolving to a place where having that type of data and that type of analysis where they could now predict the future of something by the statistics of that something right now. So they take all of the statistics in the hospital that came in for all of these different ailments and diseases. they compile them, and then they write these algorithms that will go through the data and see what's going to happen in the future. What is the probability? That's why when they talk about obesity and they say that obesity causes cancer and other, high blood pressure, diabetes, it's because they've taken all the statistical data for many, many, many years, compiled it together and ran algorithms. That's why if somebody's obese and they go into the doctor's like, hey, let me tell you what's going to go on in the future if you don't, turn around the behavior. So it's important to listen to your doctors when they tell you to do certain things. And I know that that could be a frustration for many of you because you have a lot of different ailments and a lot of different things hurt. So try and seek out somebody that is going to give you the care where they talk about you and your whole body and what's going on. And sometimes you may have to seek out alternatives, like a homeopathic doctor, somebody who is going to look at you differently, and still provide care. I think it's important that you see and ask the questions like, what is this going to do to me? What are the side effects? And stay with a person or doctor that is going to give you the answers to the things that you really need. But the data itself is very interesting on how, and all of you could look this up, if you have a computer or a cell phone, you could find out a lot of the information of your statistical outcome and what that looks like. And moving that body we talk about all the time. And next week I'm going to do an entire segment just on exercise, because the new things that I've been finding out about it in the research actually this morning in one of my classes is incredible on how your body changes. So when we have control, you have control over certain things in your life and you don't have control over other things. So how do we take something that we believe that we don't have control over? Like, I don't have control over the weather, right? Exactly. You figure out what you're going to do in terms of that. So I don't have control over, maybe an illness or something like that. But I have opportunities to seek out special help. I have opportunities to ask the questions. I'm not a doctor, but please call me or come in or, ask questions. I could send you resources and things that may be able to just allow you to ask the different questions that you need to ask. But finding out all of the different things about how our bodies work and what's good for us and not good for us. Sometimes things work for a season and then they don't work anymore. It's just like exercise. When you go out and you keep the same routine over and over and over again, you're going to get some kind of injury because your body isn't meant to be this rote machine that does the same exact motion over and over again. So I would check with the different medications that you're taking and see how long you've been taking them. People come into the store and they say the same thing to me. I've been taking this multivitamin for 40 years. And that's great. You could still take that multivitamin for 40 years, but you may want to see what's new and what could change and make you support you more. Because the vitamin industry and supplement industry has clearly changed in 40 years. But my body has changed in 40 years. So who you were 40 years ago is not who you are today. So that multivitamin might have been a great choice when you were 20 or 30. But now you're 60, 70, 80. You may need more iron, or you may not need iron at all. Those are questions that you need to look at. Sometimes iron causes people to be constipated. Sometimes iron causes different reactions in the body. And people don't understand that there's an effect of those things. So maybe you had a vitamin with iron in it for the last 40 years, but now your body's responding differently. Maybe it's time to get a vitamin without iron. I mean, that's just an example. we have vitamins that support your energy level. So maybe you had a vitamin for 40 years that looked one way, but now you're saying, look, I feel sluggish. I don't feel right. I need more energy. Well, there's vitamins out there that have more Bs in there and more energy boosters in there. So that may be a change or something you want to do to support your body a little bit differently. So you need to look at what you've been doing to your body and what the future looks like for your body. And that's what was interesting about studying out this data today, is because it does make me think about how we could collect data now for a future. But you know what? We could collect our own data of what we've done in the past to our body and what our future is going to look like. So this is Barbara and James, 352-315-1410, and we will be back.